Are you faithfully taking your amlodipine every single day, hoping to keep your blood pressure steady, but still find yourself feeling uneasy or wondering if it's truly doing all it can for your heart? You're certainly not alone in this. It's a painful reality for so many of us who are committed to our health routines. Yet sometimes, despite our best efforts, we unknowingly invite habits or foods into our lives that can actually work against the very medication meant to protect us. It's like putting out a fire while someone else is adding fuel. And you don't even realize it. The secret, it's often found in the seemingly small, everyday choices we make, the ones we rarely associate with our heart medication. What if I told you there are 5 very common things you might even consider healthy or harmless, that could be silently undermining your amlodipine and putting your heart health at risk? These aren't obscure, complicated medical facts, but rather practical, easy to understand insights that every senior on amlodipine absolutely needs to know. In this video, we're going to gently uncover these 5 surprising things you should avoid right now to ensure your amlodipine works as effectively as possible, safeguarding your precious heart. Stick with me until the very end, because I promise there's something important waiting for you that might just surprise you and change the way you think about your daily routine. Let's dive right into the first surprising thing you might need to reconsider if you're taking amlodipine. And for many, it comes as quite a shock. It's the seemingly innocent grapefruit. Now, I know what you might be thinking. Grapefruit, a healthy fruit, packed with vitamin C. How could that possibly be a problem? Well, it turns out, grapefruit and its juice contains certain natural compounds that can interfere with the way your body processes amlodipine. Think of it like this. Your body has a special clean-up crew, a group of enzymes that's responsible for breaking down medications and getting them out of your system once they've done their job. Grapefruit can actually put a wrench in the gears of that cleanup crew, slowing them down significantly. What happens then, instead of your amlodipine being processed and cleared at the normal rate, it lingers in your bloodstream for much longer and in higher concentrations than intended. This means you could effectively be getting a much larger dose of the medication than your doctor prescribed, even if you're taking the exact same pill size. And while amlodipine is designed to lower your blood pressure, too much of a good thing can quickly become a bad thing when levels become too high. You might experience side effects like a sudden, dramatic drop in blood pressure, leading to dizziness, lightheadedness, or even fainting. Imagine standing up from your favorite armchair, feeling a sudden rush, and having to grab onto something to steady yourself. That's a common scenario when your blood pressure dips too low. You might also notice increased swelling in your ankles or feet, or even a persistent headache, all of which could be signs that your amlodipine levels are higher than they should be. It's truly remarkable how a simple fruit can have such a profound impact on a powerful medication. The safest approach, if you're on amlodipine, is to completely avoid grapefruit and grapefruit juice. It's a small sacrifice when you consider the potential risks to your heart health and overall well-being. There are so many other wonderful, healthy fruits out there to enjoy, like oranges, berries, or apples, that won't interfere with your medication. Your doctor or pharmacist can always provide a full list of safe alternatives. But generally, citrus fruits that aren't grapefruit are usually fine. The key here is not to be alarmed, but to be informed and make these tiny, proactive adjustments for your continued safety. Now, let's smoothly move on to the second crucial area we need to talk about. One that impacts almost all of us, especially as we age, the silent yet pervasive enemy hiding in many of our favorite foods: excessive sodium. We all know that sodium, or salt, contributes to high blood pressure. But when you're taking amlodipine, its impact can be even more pronounced and frustrating. Amlodipine works diligently to relax your blood vessels, making it easier for your heart to pump blood and reducing the pressure against your artery walls. However, if your diet is consistently high in sodium, you're essentially asking your medication to fight an uphill battle. Every single day, think of sodium like a tiny sponge within your body, When you consume too much of it, your body holds on to more water to dilute that excess sodium. This extra fluid then increases the volume of blood circulating in your blood vessels. More blood volume means more pressure on your artery walls. And suddenly, your amlodipine has to work much harder to achieve its blood pressure lowering effect. It's like trying to lower the water level in a full bathtub while someone else keeps turning on the tap. You can drain it. But it's a constant struggle. Many seniors find themselves confused, wondering why their blood pressure readings aren't quite where they want them to be, even though they're diligently taking their medication. Often, the culprit is hidden sodium. It's not just the salt shaker on your table. It's lurking in processed foods like canned soups, frozen meals, deli meats, savory snacks, and even seemingly innocent bread and breakfast cereals. Restaurants, too, are notorious for their high sodium content. The good news is, taking control of your sodium intake is entirely within your reach. It involves becoming a label reader, turning over those packages and checking the nutrition facts for sodium content. Aim for foods labeled low sodium or no added salt. Cook more meals at home, where you have full control over the ingredients. Experiment with herbs and spices like garlic powder, onion powder, paprika, or chili flakes to add flavor without relying on salt. Fresh vegetables, fruits, lean proteins, and whole grains are naturally low in sodium and incredibly beneficial for your heart. Even small reductions can make a noticeable difference, allowing your amlodipine to do its job more effectively and truly protect your heart. It's about empowering yourself with knowledge and making conscious choices that support your medication, rather than hinder it. We're not talking about completely bland food here, but rather a mindful approach to what you put into your body, letting your medication be the hero it's meant to be. Now that we've talked about how grapefruit can interfere with your medication's levels and how sodium can make your amlodipine work harder, let's move on to something that might surprise you even more, especially if you rely on common over-the-counter remedies for everyday aches and pains. I'm talking about non-steroidal anti-inflammatory drugs, or NSAIDs. These include familiar names like ibuprofen, often found as Advil or Motrin, and naproxen, like Aleve. Many of us reach for these without a second thought when we have a headache, muscle soreness, or arthritis pain. They're readily available, seem harmless, and provide quick relief. However, for seniors taking amlodipine, NSAIDs can pose a significant challenge to your heart health and the effectiveness of your medication. Here's why NSAIDs can cause your body to retain sodium and water. Sound familiar? It's similar to the effect of eating too much salt. This fluid retention directly increases your blood pressure. So, while your amlodipine is working diligently to relax your blood vessels and bring your blood pressure down, NSAIDs are simultaneously causing your body to hold on to more fluid, effectively pushing your blood pressure back up. It's a frustrating cycle where one medication is undoing the good work of the other. Imagine your heart as a pump, and your amlodipine is easing the pressure in the pipes. But then NSAIDs come along and make the pipes narrower by adding more fluid volume. It's counterproductive, and it can leave you with persistently high blood pressure readings, even though you're taking your prescribed medication faithfully. For some, regular use of NSAIDs can even lead to swelling in the ankles and feet, a symptom that might be mistakenly attributed solely to the amlodipine, when, in fact, the NSAID is a major contributor. What's the alternative for pain relief? You might wonder. It's a really important question for seniors, as aches and pains are a part of life. For mild pain, acetaminophen, commonly known as Tylenol, is generally considered a safer option for most people taking amlodipine, as it doesn't typically affect blood pressure or interact with calcium channel blockers in the same way NSAIDs do. However, even with acetaminophen, it's vital to stick to the recommended dosage and to discuss its regular use with your doctor, especially if you have liver issues. For chronic pain, exploring non-pharmacological approaches like gentle exercise, physical therapy, heat or cold therapy, or even mindfulness techniques can be incredibly beneficial. Always have an open conversation with your healthcare provider about managing your pain, letting them know all the medications and supplements you're taking, including over-the-counter ones. They can help you find safe and effective strategies that won't compromise your heart health or the efficacy of your amlodipine. Being mindful of these common pain relievers is a crucial step in truly supporting your heart and allowing your amlodipine to perform its vital function without interference. Next, let's gently address something many of us enjoy in moderation, but which can become problematic when mixed with amlodipine excessive alcohol consumption. Now, I'm not suggesting you have to become a teetotaler overnight, but understanding how alcohol interacts with your heart medication is incredibly important. Amlodipine, as we know, works by relaxing your blood vessels to lower blood pressure. Alcohol also has a vasodilatory effect, meaning it can cause your blood vessels to relax and widen. When you combine these two, especially in larger quantities, the effect can be additive, leading to a much more significant drop in blood pressure than intended. Imagine you're standing on a perfectly stable ground, and suddenly, the floor beneath you drops. That's what can happen when your blood pressure dips too low too quickly. You might experience severe dizziness, lightheadedness, or even fainting spells. This is not only uncomfortable, but can be dangerous, increasing your risk of falls, which for seniors can have very serious consequences. Beyond the immediate blood pressure effect, heavy or chronic alcohol use is generally detrimental to heart health. It can weaken the heart muscle, contribute to irregular heart rhythms, and raise triglyceride levels, all of which are counterproductive to managing hypertension and maintaining a healthy heart. While a small, occasional drink might be permissible for some individuals, it's absolutely essential to discuss your alcohol consumption habits with your doctor. They can provide personalized advice based on your specific health profile, the dosage of your amlodipine, and any other medications you might be taking. The goal isn't to deny yourself enjoyment, but to make informed choices that prioritize your safety and heart vitality. Moderation and communication with your doctor are key here, ensuring that your social habits don't inadvertently undermine the hard work your amlodipine is doing for you. Finally, we come to the fifth common item that can interfere with your amlodipine, and it's one that often catches people off guard because it's so commonly used for those annoying sniffles and congestion certain over-the-counter cold and flu medications, specifically those containing decongestants. When you're feeling under the weather with a stuffy nose or sinus pressure, reaching for a multi-symptom cold remedy seems like the natural thing to do. However, many of these products contain ingredients like pseudoephedrine or phenylephrine, which are designed to constrict blood vessels in your nose to reduce swelling and clear congestion. While this works wonders for a blocked nose, it has a systemic effect, meaning it impacts blood vessels throughout your entire body. These decongestants cause blood vessels to narrow, which, as you can imagine, directly increases your blood pressure. So, once again, your amlodipine is working to relax your vessels and lower pressure, while the decongestant is doing the exact opposite, making them constrict and raising it. It's like trying to cool a room by opening a window while simultaneously turning on a heater. You're working against yourself. For someone on amlodipine, this can lead to an undesirable spike in blood pressure, negating the benefits of your medication and potentially putting extra strain on your heart. You might feel more anxious, experience heart palpitations, or simply see your blood pressure readings stubbornly high during a cold. So, what should you do when a cold strikes instead of reaching for those multi-symptom cold remedies? Opt for decongestant-free alternatives. Simple saline nasal sprays can effectively clear congestion without affecting your blood pressure. For coughs, a cough suppressant or expectorant that doesn't contain decongestants is usually safe. Pain relievers like acetaminophen can help with body aches and fever. As we discussed, always check the ingredient list on any over-the-counter medication. And if you're unsure, don't hesitate to ask your pharmacist. They are a fantastic resource and can quickly tell you which products are safe for someone taking amlodipine. Understanding this interaction empowers you to navigate cold and flu seasons safely, ensuring your heart medication continues its important work without unexpected obstacles. So, we've journeyed through 5 crucial areas that can profoundly impact your heart health, especially when you're relying on amlodipine to keep your blood pressure in check. We started by uncovering the surprising truth about grapefruit and its juice, and how those seemingly healthy choices can actually cause your amlodipine levels to soar, potentially leading to unwanted side effects like dizziness and swelling. Then, we delved into the pervasive challenge of excessive sodium in our diets, reminding ourselves how hidden salt in processed foods can make your amlodipine work overtime, constantly fighting to lower blood pressure against the tide of fluid retention. We also shone a light on common over-the-counter pain relievers, specifically NSAIDs like ibuprofen, explaining how they can counteract your medication's blood pressure-lowering effects by causing your body to hold onto water, and discussed safer alternatives like acetaminophen. Next, we carefully considered alcohol, highlighting how excessive consumption, even if it feels relaxing in the moment, can dangerously amplify amlodipine's effects, leading to a sudden, hazardous drop in blood pressure and increasing your risk of falls. And finally, we wrapped up with a vital warning about those seemingly innocent cold and flu medications containing decongestants, emphasizing how they can stealthily raise your blood pressure, directly opposing the good work your amlodipine is doing for your heart. Now, I know this might feel like a lot to take in, and perhaps some of these revelations have surprised you, maybe even a little bit, but please, don't feel overwhelmed or discouraged. Think of this not as a list of restrictions, but as a roadmap to greater understanding and empowerment. This isn't about rigid rules, but about making informed, conscious choices that truly support your health journey. Every single one of these adjustments, no matter how small they seem, contributes to a healthier, more vibrant you. Remember, small changes, when consistently applied, can make a profoundly big difference to your heart health and overall happiness. Imagine the peace of mind knowing you're doing everything you can to make your medication work as effectively as possible, safeguarding your heart for years to come. Your heart is a magnificent, resilient organ, and by being mindful of these 5 things, you're not just taking a pill, you're actively participating in its well-being. It's about creating a harmonious environment within your body where your amlodipine can truly shine, helping you maintain optimal blood pressure and live life to the fullest. Think of yourself as the captain of your own ship, and this information as the updated navigation chart, guiding you around potential hidden reefs. I genuinely hope this conversation has been helpful and has provided you with valuable insights you can put into practice right away. Your experiences and thoughts are so incredibly important, and I truly love hearing from each and every one of you. So, please, I encourage you to share your thoughts in the comments below. Have you experienced any of these interactions? Do you have a tip or a story to share about managing your health while on amlodipine? Your insights could genuinely help someone else in our wonderful community. Let's learn from each other and support one another on this journey to better health. If you found this video helpful, if it clarified something for you, or if it simply offered a fresh perspective, please take a moment to give it a thumbs up. Liking the video truly helps it reach more seniors like you who could benefit from this vital information. And if you haven't already, consider subscribing to our channel. We're dedicated to bringing you more practical, easy to understand advice and encouraging messages to help you navigate the journey of aging with confidence, vitality, and joy. Becoming part of our community means you won't miss out on future tips and tricks to live your best life at every age. Your support helps us continue to create content that genuinely makes a difference. Thank you so much for spending this time with me today. Remember, every day is an opportunity to make choices that nourish your body and uplift your spirit. Stay informed, stay empowered, and most importantly, keep living your best life at every age.